are the problems with mesh implant?
Hi guys, I'm Dr. Iraniha from Surgical Oasis Institute. Today I want to talk to you about what surgical mesh is and what are the main problems with the surgical mesh. So surgical mesh is a woven sheet from the different type of plastic, could be permanent or temporarily, and it's designed to place during the hernia repair or pelvic floor repair and to reconstruct the abdominal wall or reinforce the closure. Now, there are many problems with the mesh that has been reported, and I'm going to tell you about three main categories of the problems today. One is mesh recall. So obviously mesh companies are like a car companies. There are different type of car companies, and every company comes up with a different model. And over the last 45 years in the United States, there are many companies came up with a different type of mesh, and once in a while one of them are not engineered appropriately and recalled. So that's one of the things that create trouble for some of the patients. And going to a surgeon that is extremely experienced and have been using the mesh for repair of hernia for many years, very familiar with this type of mesh recall, and they could discuss that with you. The second one is wrong or inappropriate placement of the mesh. Obviously, if you place the mesh in the wrong place or appropriately place that in the abdominal wall or in the pelvic floor, then you can create problems and complications. So again, it goes back to the experience of the surgeon, how well they place the mesh in an appropriate location to prevent those complications. And the third problem is actually the actual mesh creates sometimes the problem. So it has nothing to do with the recall or inappropriate placement by the surgeon. When you place the mesh, for example, in an area that there's nerve involved, because the mesh create an exaggerated form of scar tissue, sometimes the scar tissue goes around the nerve and suffocate the nerve and create chronic pain. Or sometimes patients with the mesh, the actual mesh, can feel the mesh in a permanent way and create them discomfort during the regular activities and change their quality of life. And again, placement of the mesh in the appropriate location to decrease the possibility of complications related to the mesh is very critical. So when you go to a hernia surgeon that is very experienced, they look at your body habitus, the type of hernia you have, the size of hernia, and they can make appropriate decisions how and where to put the mesh in order to decrease all of those main complications. So for further discussion or consultation, please contact my office at 949-646-8444 or go to my YouTube channel for looking at my surgical hernia repair or looking at the different lectures and discussions that I have about the hernia.